Hi, Dr.Z. We are back to continue the conversation over topics that are really important. I really just appreciate you being here.
I'm glad to be back.
So, my question is a continued conversation on OCD, and I'm wondering if you can share with us what are some common medication therapies that are used to treat OCD. And what are some expected side effects, just to clarify for us as parents, because I know I'm guilty of going to Dr. Google and seeing all sorts of things. And so I think it's best for us to ask you so we can get that clarification.
No, thank you for asking that question. And Dr. Google is not as bad as we might think. And actually, I will encourage parents to please go to Dr. Google before starting the medication so that you can ask all those questions from the psychiatrist, pediatrician, or the providers. Because I really want you to feel comfortable and really want you to feel understood, heard, and all those question queries being answered before you consider starting the medication. I was in when I was in training at Harvard. So I used to get excited when I find out that someone is struggling with all these symptoms and no one was able to diagnose, and no, I diagnose, and but then I get excited. I need to help, I need to treat, and I need to start the medication. They have been struggling for so many years, and I need to start right away. I need to start on a higher dose if someone is struggling more severe symptoms. So then I went to my supervisor, and he said, Mohammed, I'm glad you were able to find that this child is struggling with OCD. And but if someone is struggling with OCD for years, having parents take some time to understand the medication, understand all the question concerns, is not going to delay the treatment. Because my concern was, okay, so now as a parent, and I used to try to convince parent in my early area, that you need to understand, he has been struggling with this. No, we discussed that he, she, or they are struggling with this, and this medication will help. What can I answer? So I was more kind of convincing them.
Yeah.
But my supervisor told me, the role of a psychiatrist is an educator, not the convincer. So let's say you found someone who have OCD. You can see the child is struggling with OCD, unable to go to school, unable to go to park. Parents have been missing out all those things. But if parents say, can we discuss in next session? Can you please share all those reading material? Or can I read on Dr. Google the medication that you're saying has this side effect? Can we have a little bit more time? I should not feel in my side that, why they are not understanding. What am I missing? How can I convince them? So my goal is to help them educate, meet where they are at, and keep that door open. So that is one, I would like parents to just know that as a psychiatrist, as a prescriber, our goal is to educate, not to convince. The second thing I would like to share is, especially in children, because their brains are growing, it's always important to start low and go slow. We will start with a low dose and then gradually go up. Many side effects that we read on Dr. Google or maybe heard sometime could be related that someone has started a higher dose or started dose but then went up pretty fast on increasing the dose. But that's what I learned is start low and go slow. And the common medications that we used are a broader category is called selective serotonin reuptake inhibitor, and the common medication in those categories are fluoxetine, which come with the name of Prozac, escitalopram, Lexapro, um, sertraline, Zoloft. And there is another one which is more commonly used because it has more selective impact on OCD, is called Luvox, which is fluvoxamine. So that is in that category of medicine. There are some other category of medicine that we use in specifically with OCDs called tricyclic antidepressant, which are a little bit older medicine. And one medicine that is specifically for OCD is clomipramine. It comes under the name of anephrolone. So, so first, I think it's important to, if you want to take some time, please take some time. Ask, the psychiatrist or the prescriber, please give us all the name. Please share some resources. I usually go, let's say, if I want to start someone on Prozac, okay, so I will put in Dr. Google, okay, I will not. So I will put on Dr. Google Prozac Mayo Clinic, because I found Mayo Clinic, they give you, all the details about, what are the common side effects, what are the rare side effects. So it will give you more details. Similarly, so those kind of resources are more authentic. And there must be many other, but that's where I usually go. So yes, you read everything, but also go to some, the bigger institution, they may have some resources on it. So you can get more awareness, which are the common side effects, which are the rare side effects. And some of these medicine, a lot of time parents say, but how long? So most of these medicine, they take 4 to 6 weeks to kick in. Okay? So it doesn't start working right away. So if the medication is not working in the beginning, it means that it didn't start working right away, because it takes that time. Mm-hmm. In the beginning, we see stomach upset, nausea, vomiting. Most of the time, those side effects goes away over time. But sometimes, if those are really bad, definitely please discuss with your psychiatrist to see what else need to be done. Some of the other side effects, when you see the most scary one, that's what we see everywhere on Dr. Google, is suicidal ideation with this medication. And that's why you call it a black box warning. So that is definitely one of the side effects, but not very common side effect to happen. And actually, the research is showing kids, or who takes this medication, they are way more protective in children to not do suicide, should not have suicidal ideation, suicidal thought, or not attempt on it when they take these medicine. So it has way more protection. And maybe sometime, I can go in detail, where did this side effect came from, what is the history, so that, people have more better understanding. But these are more protective than, the cause the side effect. Similarly, someone is in teenager, young adolescent, sexual side effects are other, we need to, depending on the age, so that's another something, again, not happen to everyone, but I think it's just to have some awareness around it. Some issue on the sleep. Sometime, it may have cause some insomnia, some sleep problems, some nightmares, REM sleep. So again, not everyone, but if those things happen, you let your psychiatrist right away. But overall, as I said, that's very important to establish a diagnosis first, so that no one is treating your symptom. And once you have the diagnosis, I can tell you there is a significant research that is showing therapy and medication will help. Yes, medication have side effects, but most of those side effects are manageable. And please, whenever you go for a follow-up, write down all those side effects so that you can discuss with your psychiatrist as well.
Thank you so much for sharing that. I think that when we look on Dr. Google, we sometimes, as a parent, I know for me, I panic. I'm like, oh my gosh, I don't want my child to be nauseous, or I don't want them. And you, of course, you see the suicidal ideation, and you're like, oh my gosh. But it's so relieving to me to hear you say that that is something that's commonly seen. And I think the super important thing that you kept saying was, talk to your doctor, let them know about the side effects, let them, if this is severe, you need to let someone know. And so I think it's important to know these are common things that can happen. This is how long that it takes for the medication to work. So some of these side effects are expected. And I think it's important to understand that with a medication that can happen and that you should let your doctor know when you go to a follow-up. How long do side effects typically last? Is it something that tends to go away or does it last?
That's a good question. So some of the side effect that uh, goes away over time, like within a couple of weeks, those are related to stomach upset, nausea, vomiting, sometimes dizziness as well. Some side effects may happen when you take the medicine for a little bit longer, like sexual side effects. Those are, if you are taking a longer time, then you may experience those more. So that is similarly sleep. You may experience more. And one other side effect that I'm glad you asked that question again. One other side effect is we call activation syndrome. So in an activation syndrome, like you take the medicine and immediately, like within days or so, you start feeling more angry, more irritable, and unable to sit still. So that is something you have to talk your psychiatrist right away. The other thing is, if you are taking any other medicine, even over the counter medicine, some of the over the counter medicine, they may have some interaction with this medicine. If you are taking anything that is, natural, because some of natural supplements may have some interaction. So with these drugs, so it's important to have that discussion with your psychiatrist. And you can also, check again. It's okay to put on Dr. Google. You may come a lot of scary things, but it's okay to put, I'm taking Prozac and plus this, is there any side effect? So those are the other things that's important to share, both your over-the-counter, your medical medication, or your natural medications when you start on not only the psychiatric medication, but any other medication. Make sure you share with your doctor what are the medication you are taking.
Thank you so much for that. That's a great reminder, to anyone that's watching is for sure remember that this is, educational. It's meant to inform you and to empower you to definitely speak to your doctor. This is not meant to treat or diagnose anything, and that most important is the communication that you have with your doctor to use your voice and say, this is happening, this is what I'm feeling, this is what I'm experiencing. And I really appreciate your time because this is so important to understand that this is why you have these follow-ups to ask the questions, and it's up to us as patients to say this is what we're feeling and equally this is what I'm taking, because there can be contraindications. So super,
Definitely.
super important. Thank you so much as always for this valuable conversation, and I look forward to the next time.
No, thank you so much. And always remember, if anything urgent, emergent, please don't hesitate to call 911 or go to your nearest emergency room as well. Thank you.